Assalamu alaikum. So this is another pedicle of a non-functioning kidney on the left side. We have completed mobilization of the colon, identification of the ureter, and dissection of the lower pole, and now we are on the pedicle. So as this is a kidney which has been harboring renal stones, he underwent a left pyelonephritis around 15 years back, and then 3 years back he underwent a percutaneous nephrolithectomy, and now he presented to me with a gross hydronephrosis of this kidney with some small peripheral stones and paper thin cortex on a CT KUB. So I went for the renal DTPA scan, which showed non-functioning kidney. That's why the kidney has a little bit of inflammation around its pedicle as well. The renal vein can be seen quite easily. It's a small renal vein. However, the artery has got a little bit of inflammatory tissue around it, and there is a lot of inflammation and lymphatic around the tissue. Here you can see that the artery. Now the artery cannot be differentiated from the lymphatic, and the lymphatic is as big as the artery. Here the arrow shows that we are separating this lymphatic from the artery. As the lymphatic is as big as the artery, I'll have to clip it to be sure that it doesn't bleed and it doesn't pour any lymph after the division. So we are done with the lymphatic now. We complete the dissection of the artery, the tips of my both instruments touching behind the artery, so the dissection is complete. So we place 2 clips now using the right angle to dissect behind the vein, and then we will see in the meanwhile some small venule may have started bleeding. We can see that the vein is not distending, so we can apply the clips to the vein now, and then we can cut the vein between the clips in bits and pieces. The last part is done with the ligation, as there was some small bleeder behind the vein while we dissected it with the right angle. Now it is quite easy, as the artery was in a typical location. So we applied another clip proximally, and then distally we did not apply any clip and just completed with the ligation. Thank you very much for watching.